with a good latch and good positioning. And so there's basically 5 ways to position a baby for feeds. We show mamas, and then she gravitates to what she likes best. Some of the key points is that her baby should be rotated facing her. Their ear, their shoulder, their hip should all be lined up facing her. We don't want babies on their back having to turn their head to get to the breast. None of us drink like that. We don't drink across our shoulder, we drink midline. And so whatever the position is, the baby needs to be facing her. And so if the baby was at her side, they're rotated in and they would be facing her. And so with a nice deep latch, it's efficient and effective for the baby, and then it's comfortable for a mama. For a mom to know if she has a good latch versus a bad latch, hers is going to be comfort. If I am assisting with a feed, I can see sometimes baby will tuck their bottom lip in instead of out. Breastfed babies nurse with a big open mouth. Their top lip's up, their bottom lip's down. Nipple and areola, and it's a compression. And so if I can see a motion that the baby's going back and forth, that would not be correct. If the baby I can see has tucked their bottom lip in, I can see she's typically gonna know because it doesn't feel comfortable. So she can't really see much, hers is all by feel. And with practice, she learns the difference between, oh, okay, it didn't feel great at the beginning, but it transitioned into, okay, this is fine, which would be normal. If it is uncomfortable during the feed the whole entire time, something is not right. She would need to break the suction, reposition them, try a different position, or she needs to get some help. She needs to ask somebody, can you come help me? Initially, when our milk converts from colostrum to transitional milk, our body also responds. So we have an increase in our lymphatic system, which is edema. Edema goes to our hands, our feet, and our breasts. And so part of it is the natural body process after we've had a baby. Some moms, depending on the weight that they've gained during pregnancy and with swelling, after the baby comes, all those fluids start to shift. And so part of that can just be the normal process after a baby comes. If a mom is trying to latch her baby and the baby's having a hard time getting latched on because she's engorged, she could do some hand expression to soften the nipple and areola. She could use her electric breast pump, she could use a hand pump, and that typically will relieve some of that engorgement so that the baby can latch on. The baby's going to be the best little breast pump there ever was. There are things called nipple shields that can be utilized if necessary. It's not the end-all, be-all, fix-all because it comes with its own set of issues. Mamas that use a nipple shield, it decreases their breast milk volume 30 to 50%. So if they're using a shield, they need to do some breast expression pumping in addition to, but it can be a great tool to keep a baby at the breast, either because the baby's having a hard time latching or the mom has nipple pain or discomfort, and nursing with a shield is way less painful, so it can be a temporary solution that in time we can wean her off the shield and get the baby back directly to the breast. So there's so many tools in the shed that are available to mamas to get to the next feed, to get to the next day. Typically, if a mom has a blocked milk duct, she's gonna have an area, a localized area in her breast that's kind of lumpy and bumpy, maybe a little bit tender. If it's a plugged duct, she can do some circular massage, she can do some stroking, she could put a warm compress on her breast before she nursed or before she pumped. While she was breastfeeding or pumping, she could do some gentle stroking or breast compression, nothing aggressive on her breast. And usually a plugged duct, a mama can get to resolve within 24 hours. If it's something that's persistent, she's gonna want to reach out to her obstetrician. And if it has localized redness, if she has pain, if she has a fever, if she's nauseated, if she feels terrible, that is more like a mastitis. It's an inflammation, it's an infection. There's nothing the matter with the milk. If a mom has mastitis, she totally can breastfeed the baby, she can pump the milk, she can utilize the milk, but the mom needs to call her obstetrician for recommendation. They can continue to nurse or pump. She needs to rest. She needs to increase her fluids. She could take her pain reliever that her physician has ordered, and many times she's going to need an antibiotic from her provider. Usually within 24 hours after being on an antibiotic, a mom feels much better from mastitis, but she would still need to continue and finish her antibiotic, but her milk is totally fine. Mastitis is inflammation, infection within the breast. And so the milk is fine, there's nothing the matter with the milk, but it's an inflammation or infection in the breast tissue. Mastitis symptoms are going to be localized pain, redness. Mom typically has a fever of 101, 102. She has general body aches, feels like she has flu symptoms, and really feels bad. And so that is a call to her obstetrician. If a mom has a plugged duct, typically she can get it to resolve. If it's persistent, that she can't get to resolve after a day or so, I would have her call her obstetrician. A plugged duct doesn't always turn into a mastitis. Many times a mom will get a mastitis when she has a break in the integrity of her skin. If she has a blister, if she has a crack, that's really gonna be an opportunity that she gets mastitis, not just from plugged ducts. If a mom has a mastitis and symptoms of mastitis, she's going to want to call right away. It's an after-hours call to whomever is on call because it can make mamas really sick. They feel bad and it can make them really sick.